Exercise, a treatment for depression by David Gull, Louise Vanderploeg, Brian Wasilek, and Blake Wilkes. In order to understand how exercise can help treat depression, we must first understand what depression is and what causes it. Depression is formally defined as a condition of general emotional dejection and withdrawal, sadness greater and more prolonged than that warranted by any objective reason, which means you have uncontrollable feelings of sadness. Another point of view from the journal article What is Depression explains that depression is a brain disorder in which chemicals used by the nerve cells to communicate to each other are out of balance. Here's a take on depression by a Stanford University professor.
There are all sorts of these great made-for-TV movie diseases out there. But when you want to come to, say, basic meat and potatoes of human medical misery, there is nothing out there like depression. Depression is absolutely crippling. Depression is incredibly pervasive and thus important to talk about. I'll make the argument here today, a number of things, but one critical thing being that basically depression is like the worst disease you can get. And I'll make the argument for that in a bit. It is devastating. It is wildly common. Current estimates are 15% of us in this room will have a major depression at some point or other in our lives. So that is not good. What is also clear is it is worldwide. Currently, World Health Organization says depression is the number 4 cause of disability on this planet. And by the year 2025, it's going to be number 2 after obesity, diabetes-related disorders. So it is bad news, and it is becoming more common. Okay, so what are the symptoms about? If I had to define major depression in one sentence, I would say it's a biochemical disorder with a genetic component and early experience influences where somebody can't appreciate sunsets. And that's what this disease is about. And when you think about it, that is a very sad thing. You look at some of our major diseases, somebody with cancer, somebody crippled by heart disease, and you see the most unlikely things out there. You see somebody saying, well, obviously I'm not glad I'm dying of cancer, but without this disease, I never would have realized the importance of friends. I never would have reconciled with my family members. I never would have found my God on a completely weird level. I'm almost glad this has happened to me. Humans have this astonishing capacity to derive pleasure out of the most unlikely domains. What could possibly be worse than a disease whose defining symptom is the inability to feel pleasure? Thus, at the top of the list, anhedonia.
There are many different things that can cause depression, such as stressful life events like death of family members or loved ones, school, and work. Also, an imbalance of chemicals in the brain. If neurotransmitters cannot communicate to one another, you can lose the ability to feel. People can also be born with genetic dispositions that can make it more likely for someone to become depressed in the future. Medical conditions such as cancer and lifelong diseases can make people feel overwhelmed, out of control, and that nothing they can do can stop the rapid progression of their illness. Also, environmental effects can cause depression because people can be affected by the surroundings. Researchers have discovered another issue, that the hippocampus, which is part of the brain that stores memory, in people with depression has been found to be a lot smaller than it is in people who have never suffered from depression. There are many different theories on why the hippocampus is smaller in depressed people. Some researchers believe that the stress hormone poisons the hippocampus, which can lead to depression. Other researchers believe that some people who have depression problems are just born with a smaller hippocampus than others. MRI results show that people who have suffered from depression have abnormalities to their brain. Therefore, neurotransmitters seem to be out of balance with the rest of the brain. Christian Nordquist from Medical News Today states that the areas of the brain that deal with thinking, sleep, mood, appetite, and behavior do not appear to function normal.
Sometimes it's hard to understand exactly how life feels or looks to a depressed person, and there really is no way to explain it better than this image. Even if a depressed person spends every waking moment of their lives fighting depression, the world may still look like this to them. The reason depression is considered a mental illness is because you can't just fight back. You can't just tell yourself that you're going to rest a few days and that it'll go away. depression is a life-altering illness which can not only ruin your life, but can also change your perspective on every aspect of life, completely changing who you once were.
Exercise affects the brain in a number of ways. Dr. Hillman, an associate professor at the University of Illinois, says that studies done on humans and animals suggest that exercise, especially aerobic exercise, can positively affect multiple aspects of brain function and cognition. There are many reasons that exercise affects the brain in a positive way. When you complete a task, it adds to your self-confidence. Self-confidence is a big factor in depression for most people, and exercise can have a positive effect if used correctly. The big thing is that completing a task is good for everyone, but failing a task is different for healthy people than it is for people who are depressed. For example, if a healthy person misses a day of exercise, they would think that it's not a big deal and that they can just start tomorrow. However, if a depressed person misses a day of exercise, they can view it as a failure to the entire workout routine. This can make it hard for a depressed person to believe in themselves. But when a depressed person is able to complete these smaller tasks, it can have a bigger effect on their lives. You have to look at the depressed person's mindset. In the life of a depressed person, bigger events can have a smaller impact, and smaller events can have a bigger impact. For example, graduating from high school can seem unimportant, and that person won't think of it as a very big accomplishment. However, if they oversleep by an hour, they can feel like they have already failed, and it can ruin their entire day. So if someone with depression can successfully stay with their exercise routine, it can have a huge impact on their life. It can boost their self-confidence, it can release endorphins, and those small victories can have a big impact. All of these factors can help ease the symptoms of depression and keep it under control without the use of medicine.
There are many different types of exercise that can be beneficial to a depressed person. Running, biking, swimming, and hiking are all forms of cardiovascular exercise that are not physically challenging. Exercise makes you feel good. When you go on a run, you feel like you've done something good that day. When you lift weights and get stronger, you feel good about yourself. The word endogenous refers to any substance produced within the human body, and morphine is a chemical that can relieve pain and produce euphoria. Endorphins are a combination of the two words. Dr. G. Timothy Johnson said that endorphins are morphine-like compounds that are produced within the human body. Many types of exercise are extreme endorphin producers. Endorphins are a type of neurotransmitter, which is a chemical that passes information from one neuron to the next. Many activities that a person can do can produce endorphins. Besides exercise, some of these activities include eating certain foods, i.e. your favorite foods or hot peppers, and laughing. Endorphins have a positive effect on the depressed mind. When endorphins are released, pain that an individual is feeling, emotional or physical, may be diluted or prevented altogether. Also, these endorphins may not only block pain, but produce pleasure. So endorphins can almost block sadness in the mind of someone who is depressed, and at the same time produce happiness. This illustration demonstrates the activity of endorphins in the brain during exercise.
When considering exercise as a viable treatment for depression, you have to also consider its pros and cons as compared to other treatments for depression, with the most common being antidepressant pills. One of the biggest pros of exercise is the fact that it has relatively next to no side effects. Other than the occasional injury or overexerting yourself, it's hard for exercise to be bad for you in any way. While common antidepressants, such as fluoxetine's side effects, include sexual dysfunction, nausea, nervousness, and insomnia, agitation, decreased sweating with increased body temperature. Additionally, after depression has been deemed treated, it has a lower chance of re-emerging if treated by exercise as compared to antidepressants. Another good pro about exercise is that you can do it on your own at relatively no cost, whereas pills can be extremely costly. When comparing exercise to antidepressants, the patient's mindset has to be considered. A depressed patient most likely already has a hard time to do any daily tasks, making it very difficult for them to stay motivated enough to continue exercising for a long period of time, even if it is to help treat themselves, making pills a more desired treatment for some patients due to the low amount of energy required to take them. Other than that, exercise is a better treatment in every aspect, especially since antidepressants can have side effects that can be extreme, even deadly, if taken with other substances such as alcohol or other drugs/medications. Therefore, exercise works.
Thank you for watching our presentation on exercise as a treatment for depression. If you have any questions,